This is Q&A with Prof. A, the Iba To kay Doc Bato Medical Physiology Review Series for students. The question today is, Prof. A, what are the hormonal functions of the kidney? Aside from filtration, reabsorption, and secretion of cleared solutes in the urine, the kidneys do not only excrete urine, but they also have endocrine functions. Therefore, the kidneys produce hormones. They secrete the following hormones: erythropoietin, 1,25-dihydroxyvitamin D, renin, PGE2, and dopamine. What is erythropoietin? Erythropoietin is released in response to hypoxia. It comes from endothelial cells of peritubular capillaries. It stimulates the bone marrow to produce more red blood cells. So if you have a decrease in erythropoietin production, it will lead to normocytic normochromic anemia. Your calcitriol, or 1,25-dihydroxy2 vitamin D, is triggered by hypocalcemia. It is secreted by your proximal convoluted tubule, and calcitriol increases intestinal absorption of calcium and phosphate release from the bone. From the liver, it produces 7-dehydrocholesterol. With the aid of the skin and the sun, UV light converts it to cholecalciferol or vitamin D3. This can also be taken from our diet of fish, meat, eggs, and dairy. Vitamin D3 then is converted in the liver to form calcidiol or 25-hydroxycholecalciferol. This then is the substrate for active 1,25-dihydroxycholecalciferol or calcitriol formed in the kidney with the activity of 1-alpha-hydroxylase enzyme. Calcitriol increases calcium and phosphate absorption in the GI and promotes calcium and phosphate release in the bone. While in the kidney, it also promotes calcium reabsorption but also increases phosphate excretion. Regulating this pathway is PTH, which is secreted by the parathyroid gland, triggered by low serum calcium. PTH enhances the activity of 1-alpha-hydroxylase, increasing calcitriol levels, but also promotes calcium and phosphate reabsorption and resorption in the GI and bone, respectively. To close the loop, calcitriol regulates parathyroid hormone release from the parathyroid gland. It is released in response to decreased renal arterial pressure and increased renal sympathetic discharge from your JG cells of the juxtaglomerular apparatus through PGE2. It is secreted in various nephron segments. It maintains GFR, sodium, and water balance. The roles of renin and PGE2 are best described in the kidney's autoregulatory mechanism, which we call the tubuloglomerular feedback. Reduced filtration at the glomerulus, or increased reabsorption of sodium and water by the proximal convoluted tubule, causes fluid in the tubule at the macula densa to have a reduced concentration of sodium chloride. A complicated signaling cascade involving the activation of COX-2 and microsomal prostaglandin E synthase in the macula densa will be seen. This causes the synthesis and release of PGE2. PGE2 acts on receptors in the juxtaglomerular cells and causes renin release. As we all know, renin will convert angiotensinogen from the liver to form angiotensin 1. And angiotensin 1 will be converted to angiotensin 2 by your angiotensin-converting enzyme from the lungs. And angiotensin 2 will preferentially constrict your efferent arteriole, and as we all know, this will increase your hydrostatic pressure or improve your glomerular filtration rate. What about dopamine? Dopamine is a natriuretic hormone synthesized in the proximal tubule. It increases sodium excretion by decreasing sodium reabsorption in the proximal tubule and collecting ducts. Higher concentration, however, induces renal vasoconstriction. That is why people with chronic kidney disease do not only have problems in excreting urine, but also will have hormonal imbalances from deficiencies in erythropoietin, vitamin D, leading to anemia and bone problems, respectively, and excessive renin production from decreased GFR, making them hypertensive. For more high-yield concepts in renal physiology, don't forget to click the subscribe button.